Yep.
Okay. Okay. Well, my first question is, could you tell me the name of your company and the job title?
Sure. So I'm a physical therapist. I'm actually an independent contractor, so I work for myself. So I work through the state of Illinois doing early intervention, and I contract my services to a clinic called Building Block Pediatric Therapies.
Why did you choose this profession?
I always wanted to go into medicine. I thought I wanted to go into med school. So I just decided that, but I wasn't sure if I wanted to put in all the years for medical school, so decided to major in physical therapy because back when I graduated it was a 4-year degree, so that was kind of nice. So I knew I would have all the prereqs for medical school if I decided to go into it, but if I decided just to go into physical therapy, I'd have a job right after school, and that's what I did.
How long have you been working in this field?
22 years, and the last 13 of them have been all in pediatrics.
That's a long time.
Yeah.
What advice would you give to someone pursuing this profession today?
I would say make the most of your internships. Get as much on-the-job training as you can before you graduate, and and experience as many different type of settings as you possibly can, because you never know where your career path is going to take you, and just take advantage of those internships you have.
Can you give me some examples of the most desirable aspects of your job?
So I work all in pediatrics, and I would say the best thing about it is just giving kids mobility. So I work all on their gross motor skills, and so whether it be, an infant that's really delayed in their milestones, not learning to walk until a little later, or a kid that's neurologically impaired, that getting them the freedom to be able to move in their own capacity, and then being able to help out the families also with their children. So that's, yeah.
Do you only work with like infants, or like?
I work through infants through teenage years, mainly the infants through like early elementary school, but I do also a lot of youth sports injuries, so it's a whole variety of things I do in pediatrics.
What is a typical day like for you?
So as I said, I do early intervention, which is the state of Illinois' 0 to 3 program, and 0 years to 3 years before they go into the educational system. So doing those, I go to all home visits, so I treat their kids in their homes, and so I'll see about maybe 6 to 7 kids on certain days, just going to their homes and treating them there, and then on the other days or later in the afternoon, I'll be at the clinic and work in the gym with the kids that come to see me in the clinic.
What are the biggest challenges that you face?
I would say the biggest challenge is working with insurance companies, and having the insurance companies dictate how much physical therapy a child can receive. So, and it's, a family that might not have the best insurance, their children unfortunately are going to suffer because the insurance company won't allow enough physical therapy, or won't allow the medical equipment that a kid might need, whereas another kid in exactly the situation will benefit more if they have a better insurance plan. So that's really, really challenging. I would say the other big challenge is working with families, and families who don't follow through at all with their kids and expect me to fix their child, but won't do anything to assist their child in between visits.
Yeah. And what is the career path you followed to this position?
Okay, so I've done a lot of different things in physical therapy, which is really nice that you can do this in physical therapy. So I started off, my first 3 years out of school, I worked at a hospital, St. Joseph's Hospital, downtown Chicago. And it was really nice because I could follow a patient from when they entered the hospital all the way through outpatient. So I'd follow the same. And I did everything from, neurological patients, orthopedic, any surgeries, post-op from surgeries. I did wound care, which was terrible, but pediatrics, just so I got the whole gamut working in a hospital, which is nice. And then from there, I went, I worked at, back then it was called Caremark, and since then it's changed hands and everything, but it was outpatient orthopedics, so it was more like a sports medicine clinic. And I did that for several years until I had kids, and then I decided I wanted something with a little more flexibility, and I got an offer to work at a clinic doing pediatrics and working in a school system, which kind of allowed me that flexibility with my kids. I set up my own hours and everything. And then from there, I've just been doing pediatrics because I always knew that was going to be my niche. So, yeah.
That concludes me.
Okay.